One needs to know how to implant a capsule tension ring because zonular dialysis is not an uncommon occurrence during cataract surgery. A capsule tension ring can be implanted when the zonular dialysis is of 3 clock hours or less. There are 3 different sizes of the rings: the 10 mm for an axial length of 24 millimeters, the 11 mm ring for an axial length of 24 to 28, and the 12 mm ring for an axial length of more than 28. There are 2 simple techniques by which a capsular tension ring may be implanted. One is the manual hand over hand technique, and the other is called the fishtail technique of inserting a capsule tension ring. So let me take you through how both these techniques are done, and I will start by showing you how you do a manual hand on hand technique or CTR insertion. The manual technique is easier to do when the capsular bag is slightly empty. In this case, there is a 2 clock hours zonular dialysis around 5 o'clock, and I decide to implant the capsule tension ring. Make sure you insufflate the anterior chamber well before pulling out the phaco probe, as this will prevent zonular dialysis from extending and vitreous from prolapsing. It's wise to use the standard CTR of 10 mm. It comes packaged and ETO sterilized like this. The most important thing is to know where to hold the CTR for insertion. You need to use 2 plain forceps. And they should be held 3 millimeters away from the tips of the CTR, the 2 ends of the CTR. The 2 plain forceps will hold it close about 3 to 4 millimeters from the ends. So one end of it will direct the leading edge of the CTR under the rhexis margin. Always engage the capsular bag away from the area of zonular dialysis, and by slow hand over hand technique, you feed the capsule tension ring slowly into the capsular bag. This is done because in case there is resistance, do not try to push, as the CTR can get snagged in some cases. Now the leading eyelet is engaged with a Sinskey hook, as in this case. It's taken within the capsular bag and disengaged with an iris repositor on the other hand. Well, sometimes while using a Sinskey hook, the eyelet may slip. You see how easy it is to insert a CTR when the capsular bag is relatively empty. And this is the main indication for the manual technique. The fishtail technique, however, is indicated when the capsular bag is full. Take a look at this case. A patient with a grade 3 nuclear sclerotic cataract, and while attempting to create the first chop, I create a zonular dialysis of 2 clock hours around 2 o'clock position, and this is because of improper hold of the nucleus, leading to the transmission of stretch forces that causes the zonules to rip. So in this case, the better way of inserting the CTR is a fishtail technique, where with the help of 2 plain forceps, the CTR is flexed over itself, pushed through the incision, and all you have to do is the CTR takes the fishtail configuration. You have to put the apex of the fish into under the rhexis margin, and each of the loops are simply tucked inside the capsular bag. There is no need to dial, and there is no risk that the CTR will get snagged or it will make the zonular dialysis worse. You can see how the eyelet slipped when you use a Sinskey hook. Well, it can be retrieved and inserted. The better option would be to use an intraocular forceps. Another case in point where zonular dialysis occurs in a grade 2 nuclear sclerotic cataract. I tried to use the manual hand over hand technique initially, but I find that this is snagging. The CTR is getting snagged, and not only that, It's also making the zonular dialysis worse. There's a tilting of the nucleus. So I abandon the hand over hand technique and then switch over to the fishtail technique in this case. It's pretty simple to do the fishtail technique. Even though you're bending the CTR, there is no permanent crimping of the CTR. It doesn't get damaged because you bend it. It will regain its shape once inserted. You create the fishtail configuration, and all you have to do is push it underneath the rhexis margin in a very controlled manner. Each of these limbs of the capsule tension ring, with the help of a Sinskey hook or an intraocular forceps, is just tucked into place. In this case, I will show you that you can actually, once you engage the eyelet with the Sinskey hook and you take it underneath the capsular rhexis, you can actually dial the CTR so that it comes to convexity of the CTR comes to rest on the greatest area of zonular dialysis. So mastering CTR insertion techniques can pull you out of many tricky situations while performing phaco surgery.